Hey everybody, time for another little mini series video. This is going to be very brief. I just want to talk about teeth. Teeth. Super important to us in anesthesia land. But before I get into that, I do want to mention something about closed claims. I don't know if you guys have heard about this, talked about it in school. Dental injuries and stuff are actually, I believe, excluded from a lot of these closed claims. However, I did just want to throw it out there while we're chatting. But basically, the closed claims project, I think, started quite a while ago, maybe in the 80s when I was born. But it was to analyze some of the closed malpractice claims that came against anesthesia related complications, to try to see if they could trend those and try to kind of see what was going on so that we could be more preventative and be better. A lot of things, positioning, nerve injury. Back in the day, there was, brain damage and stuff like that, issues with intubation. Now we're fortunate. We have a lot of devices like video scopes available to us to help prevent that. But anyways, it's something to kind of look at and at least be aware of, so you can kind of see the trends of some of the most common anesthesia complications, especially where we've came from, how far we've come, but also some of the ones that are still pretty prevalent now. So just wanted to throw that out there, something to be aware of. Teeth damage is one of the most common anesthesia complications. It's not really life-threatening though, so I think that's probably why they don't dive into that, but it's still something we need to be cognizant of, all right? First of all, let's just talk really quickly about your airway assessment, right? So your airway assessment is huge. You're looking at a lot of pieces, the neck, the chin, the head, how big they can open their mouth, what size their tongue is, can they even open their mouth? But the big thing is looking at their teeth and really documenting that, guys. I had a couple videos ago, watch it on documentation. I'm crazy about documentation. But make sure you're look at their teeth. Like, are there any missing teeth? Okay, account for that somewhere in that chart, because heaven forbid, I literally have had patients had no teeth, or a couple teeth were gone and they blamed us for it, trying to get a dental bill. I'm like, oh no, that was not there pre-op, okay? So people will try to come at you for things. So make sure you're documenting that. Loose teeth. I mean, sometimes people will open their mouth and I'm like, oh my God, and I'm like, are they just wiggling in there? So I actually make them stick their hand in their mouth and I want to see it. They're like, oh no, it's not loose. And then it's hanging by a thread. So literally make them wiggle those teeth, especially right here, because that's obviously where your blade, that's where you're going to be working at, is in this front area. Anything cracked, anything chipped, anything broken. There is mixed on MAC anesthesia cases, like kind of cataracts and stuff. You guys can talk to your preceptors about this, a question to bring up about, do they leave the dentures in for MAC cases, right? Because what are we always concerned about? We're always concerned we could potentially lose the airway with sedation cases, and we got to go in there, right? And we don't want to have dentures, partials, anything like that. Other arguments, people say it does help keep the mouth kind of full without everything kind of falling back when they fall asleep. So two kind of schools of thoughts there. Make sure you guys ask your preceptors and kind of just pay attention to what your teachers and everybody does when patients do have dentures and stuff, and it's like a MAC case, a cataract or something like that. And that goes along with crowns, like I said, bridges, dentures. Usually the same-day surgery nurses are really good about looking at that, but look at all of that. Lips, is there anything cut? Some people, they might have a bruise or a cut, or it's a trauma patient. Make sure you are documenting all those things, okay? Now, as far as intubation goes, I always like to document as everything goes okay. I always document, dentition intact, or dentition unchanged, atraumatic intubation, teeth and lip intact, something like that. I do put a note there that, and same thing on emergence, patient extubated, atraumatic, dentition unchanged, lips unchanged, whatever it may be, do document that. Because like I said, there has been instances where people have tried to blame us for teeth, and I'm like, oh, that was totally like that before. One thing to kind of help with intubation. Now, some of the things to look for teeth is obviously anything loose up here, but you also have to look at prominent teeth. Some people have very prominent front teeth, and that could literally make it a difficult intubation. We had somebody with really poor dentition, big guy, prominent front teeth, and I think I wasn't there. I pre-opted him. I wasn't there for the case, and literally I think all his teeth got knocked out. But I kind of knew it. When I saw him, I was like, ooh, I said, and it was like a double lumen tube. I was like, oh my God. So I went through everything with him, document that as well. If there is a risk that they are going to lose their teeth, put it in there, you know, conversation discussed with the patient, that potentially their teeth could be knocked out during induction, because it does happen as well. But ways to kind of prepare for that, like if they're super prominent, sometimes you got to look at people's chin placement, or if they kind of have back bite, overbite, etc. All of that can kind of affect what happens, like kind of their airway placement. Sometimes I swear they have more interior airways when they have kind of different facial structures. So all those little things pay attention to. And sometimes the patients look decent and then you lay them down and you're just like seeing things that you're not expecting. Okay. But be careful, pre-oxygenate them extremely well. If you think they're going to be any type of difficulty, a lot of places have the McGrath now, or bring the glide scope in the room, get a second pair of hands, and couple schools of thought here is 2, but make sure you can ventilate them. If I'm worried that the intubation could be kind of hairy, I'm always going to try to, make sure I can at least bag them for my own peace of mind. And then really relax when you're intubating, open that mouth up, slide that blade in carefully. And then I always think I was always taught kind of like the snap back, right? So you're in here, you're in it, and boom, and you snap back, stand up, lift from here, and you'll be able to see. We don't have to tube like this, right? No, literally do that to get in, sweep the tongue and snap back. All right. Emergence, right? Emergence. Be super, and lift up there, get off the teeth and the tongue. Oh, and one other thing I do when I go in, I do a little sweep of the lips. I kind of go like this, because sometimes they can get caught. So I'll kind of go in, and as I'm coming up, I'll sweep everything. Just guys, take your time. We don't have to be oh my God, just kind of open the mouth, look, okay, are the lips in there? Nothing's in there. Okay, snap back, pull it up, all that good stuff. And then emergence. Be careful with those teeth on emergence. I'm all about a bite block. Your preceptor can let you know if they want a soft bite block, or a hard one. You're obviously worried as they go through stage 2, they bite on the ET tube and you could potentially get some negative pressure pulmonary edema. If they do have really crappy teeth, some places do have dental guards that you can use for intubation, for wake up, but make sure you're also thinking about that wake up. Maybe these patients need to be woke up deep if you can, I do have all this stuff on deep extubation somewhere in this Facebook page. But some things just kind of be thinking about. Really, really, really protect those teeth. Another thing I'll say with LMAs is, depending on what type of LMA it is, if they wake up and they bite, you could also risk them chomping. If they were already loose to begin with, you could also risk them on an LMA as well. So something to think about. Okay. So that's all I got for you about teeth. I just want you guys to be aware of it. Be cautious, be careful, rock out those intubations, do amazing pre-op assessments, really impress your clinicals with that. And everything that I'm going to be talking about is going to be put into the brand new clinical guide that is coming soon, I promise. Okay, have a good rest of your day.